Good afternoon, good morning, good evening, wherever you are listening to this in the world. Thank you all for tuning in. I wanted to try something new today. If you've been following me on LinkedIn, you've noticed I've been doing some live interviews with some experts from around the longevity and future of medicine space. I've gotten a really positive response to those. And so I'm going to experiment with doing more live content. And some of this I want to try where we dive into specific topics and do deep dives and try and make sense of some of these developments that are happening in the world. So much happening in this space that it can feel super hard to keep up with it. Um, there's no shortage of content out there, certainly that's talking about all these things. If you're on LinkedIn, you probably see all sorts of takes on these things. But what I find is lacking is number one, it feels like a lot of times people are just parroting back whatever the headlines are without any critical analysis. Or if there is analysis, it is very lightweight AI analysis, which, I'm not dismissing that as completely useless, but I think it is nice to hear from another human being who knows a little bit about the space and to get their perspective. And my goal here is sense making, right? Like, how do we make sense of what's going on here? Because it can feel like it's so hard to keep up with everything that's happening, and it can be very easy to fall into the trap of just listening to whatever the loudest voice is saying. And I think that my goal here is to get us all thinking for ourselves, thinking critically. Um, so I have selected four topics for us to talk about today. And if you're listening along live, please put your comments or questions in the chat, and I'll get to those. And we're going to go through each of these. I'm going to share with you, the gist of the headline and also kind of my thoughts and my analysis. And my hope is that over time, this will be useful for a lot of you. So let's start with this first topic, which has been really taking off. Quite a robust discussion on this on Twitter and in a lot of different spaces related to preventative health. And that is the release of a major cardiovascular trial called the Easy Pave trial. And in this study, the headline findings would seem to suggest that the people who claim that lower LDL is better might actually be correct. Now, that's just the headline. That's what a lot of the headlines are saying. I think if we look closer, I think there's some other things for us to think about. But just to kind of give you guys a summary of what happened in this paper, basically, this was just presented at the American College of Cardiology in New Orleans, and what it basically found was that patients who had existing cardiovascular disease, who hit an LDL target of 55, less than 55, had over a 33% reduction in major cardiovascular events compared to people who targeted a goal of less than 70. And so this is really quite surprising, because this is not less than 70 versus less than 55 is not a huge difference. It's not a huge difference. And yet targeting even this 15 or 25 milligrams per deciliter, having that difference in targeting seemed to have a major effect. 33% reduction in major cardiovascular events, really, really significant. And so a lot of people are out there saying, like, hey, this is just another feather in the cap of this idea that the lower the LDL we have, the better the results. So there's a lot of people who are saying that, and of course, there's a lot of people who are questioning that. And the topics around cholesterol, around statins, these are just hot button issues. If you ever mention these things, you can really spark a raging debate. And so, how should we think about this, right? I think we've known for some time that LDL and cholesterol, the so-called bad cholesterol, plays a major role in the pathogenesis of cardiovascular disease. The question is, how aggressively should we focus on this risk factor? I think that the idea of it being a risk factor is undeniable at this point. Like the idea that this contributes in some way is undeniable. I think that the questions that people raise is this the risk factor? Is this the factor for us to focus on? Should we be focused holistically on the entire process of atherosclerosis, which we know implicates inflammation in the immune system, it implicates metabolism and how effectively we process carbohydrates. There's lots and lots of other different pieces to this. Should we be focusing more holistically on the whole system than just one risk factor? And so we've kind of had this tug of war back and forth on what to do here. And to me, I'll tell you my perspective. To me, like I think this is an important finding, but I take a step back and I'm not sure how dramatically this changes the overall picture in terms of how we understand cardiovascular disease and what it is. Again, like we've known for some time that cholesterol plays a really important role, specifically certain certain lipoproteins play a significant role in cardiovascular disease. But is this the only thing? And I look at the fact that there is a significant number of people who show up in emergency rooms with acute myocardial infarctions, heart attacks, who have perfectly healthy LDLs. There are different numbers. In some studies, it's up to 70% of people who show up having an MI have a LDL that's at goal. So what's happening? Why is this? If this is solely deterministic, why do we still see people develop heart attacks, even when this is fully controlled? And by the way, there's a course that we're going to be releasing on Next Generation Medicine on the topic of the systems biology of cardiovascular disease that basically looks more deeply at this question. And this is from Dr. Abid Hussain, who's probably one of the best in the world about understanding cardiovascular disease from this holistic perspective. But I think that to me, this finding does not substantially change how I think about cardiovascular disease. I think that we should be managing lipids, thoughtfully. We should be managing them aggressively in people who have other risk factors. But I still think we have to keep our eyes on the other things that contribute to cardiovascular disease. There are a few other things that came up with respect to this trial that I think are worth thinking about. A lot of people are wondering about the population that was studied. This study was done in South Korea, and a lot of the patients were actually male. And so there's some generalizability questions about this. Like, was there something about this cohort that made them more sensitive to even modest LDL reduction targets? And in case you're wondering, the cohort was only 20% women, so 80% men. So does this generalize to women? We don't know. Does it generalize to people who are not of East Asian extraction? We don't know. And there's others who push for even lower targets, or like Peter Attia and others push for LDL sometimes lower than 30. And they'll point to the fact that, hey, young children, babies have LDLs like of 10, and they're thriving. So why don't we just drive it all the way down so that we can fully reduce this risk factor? And there's debate about neurocognitive concerns at that level. I think that's very much an open debate. Um, and so I think that those are all valid questions. Um, I think that at the same time, though, to deny the importance of ApoB and or LDL in the pathogenesis of cardiovascular disease, I think is also um, uh, I would disagree with, right? Like I think this is we have to look at this. We can't just let an ApoB ride high or ride wherever it needs to go. Um, there are some people who advocate for that. They say, "Oh, you can let ApoB go wherever it needs to as long as you're metabolically healthy. It's fine. Cholesterol is fine." I I think that from a systems biology perspective, at this point, it is to me indisputable that this is a very important factor. But I think at the same time, it is not the only factor. So what do I think? Well, I think that I would like to see more studies that look at how we targeting other risk factors, in particular, reduction of inflammation, um, using the different therapies that we have at our disposal now, namely GLP-1s. And I know that a lot of this is in process, but you know, how can we, when we address the systems biology of cardiovascular disease, how might we see different effects on events? Um, and the other thing that I think I would just emphasize is the importance of doing better screenings. And this is a topic that I know a lot of my colleagues are passionate about. But um, you know, again, when you think about the fact that a lot of people who wind up with heart attacks have LDLs that are totally normal, um, to me, that begs the question, should we be looking more closely on screening for cardiovascular disease through different means? And this is where I think coronary CTA just plays a really important role. Um, and companies like Clearly and HeartFlow and others can do this, facilitated by AI. And I think we should be using these tools more so that we can understand not just what contributes to cardiovascular disease, but who actually has it and get ahead of it. So I think super important paper, definitely worth reading or dissecting if you have the time. But to me, I would say I don't think it fundamentally changes how I think about systems biology of cardiovascular disease. I think I already felt that lowering ApoB was important. Um, I don't think this makes the case conclusively that we should drive it down as low as we can. I think it just tells us that it's a very important factor. But I think that there's still much more to the story that we need to look at. So let's now shift to the next topic here, um, which is the development of artificial intelligence drug development, artificial intelligence facilitated drug development. And so last week, I believe, or this week, was announced that Eli Lilly paid over $2.75 billion to acquire a company called In Silico Medicine. Um, and this is a Hong Kong-based AI drug discovery company that has one of the largest AI portfolios, novel oral therapeutics, all in preclinical development. It's important to note that the nature of this deal was heavily backloaded, um, meaning that the deal was structured in such a way that In Silico gets $115 million up front, and then the rest of it is tied to milestones, right? So this is not a straight up acquisition; it is a milestone based uh, deal. Um, and so right now there's 28 drugs in development. These were developed using generative AI, among other AI-based technologies. Half of these are already in clinical stages, and there were over 20 preclinical candidates that were nominated between 2021 and 2024, with an average turnaround of 12 to 18 months compared to 3 to 6 years in conventional drug discovery. Important to note that no AI discovered drug to date has received full FDA approval. They have one drug called ISM 001 055, which is showing positive phase 2A results for idiopathic pulmonary fibrosis, but none of these have been fully approved. So it still remains to be seen, how successful these AI-based drugs will actually be in clinical practice. But I'll tell you my take. Like, I am tremendously bullish on AI-driven drug development. I think that it's just a matter of time before we have dozens of highly successful uh, AI discovered drugs in clinical practice. To me, the bigger issue is actually how can we get more effective at actually reviewing all these drugs, right? I think that our ability to test drugs is going to be far outstripped by our ability to discover them. And so to me, what is imperative is that we find a way to move towards a clinical trial infrastructure that lets us test things much faster. And I think that the phase 1, phase 2, phase 3 based structure that we've had, now for probably 100 years or something, has served us well. But I think it's time for a new model. I think, to me, this is just way too slow. And I think that it's not going to be fast enough for everything that we need to push through the pipeline with these technologies that we have. So we have to get faster. We have to get smarter. I think there's already been some very good work around that has come from the FDA, or proposals basically moving more towards in silico based early stage trials, having more of a focus on safety being the key barrier versus efficacy, which can be a little bit harder to define, and shifting more of the market, shifting more of the burden of efficacy towards the market. And so I think that to me, this is exciting. It's great. But I think that we're not going to realize the full promise of AI-based drug delivery or drug discovery if we don't substantially modernize and streamline our infrastructure for doing clinical trials. It's just not going to work. The way that we're doing things right now is just not going to work. So super interesting, super exciting, but I think that we need to keep our eyes focused on actually changing the clinical trial infrastructure. So next topic, which is somewhat related, is on the topic of David Sinclair's aging reversal technology, which he spent a lot of time talking about. And this all relates to his company, Life Biosciences, which has been really focused on partial epigenetic reprogramming. They've been focused predominantly on vision restoration for patients with glaucoma and non-ischemic, non-arteritic anterior ischemic optic neuropathy, or NAION. And this is the first FDA-approved human trial that's specifically designed to test whether aging can be partially reversed in living humans. And so the company is actually enrolling patients right now. Results are expected in late 2026 or early 2027 if it works. It's going to be the most consequential medical result, in recent memory. And so, for those of you who don't know, the idea behind epigenetic reprogramming ties to this theory called the information theory of aging. And this idea is that our cells have a program that basically can function at the level of a perfectly youthful cell. So we have the ability to function in a youthful fashion contained with our cells. And so to make an analogy to a smartphone, we can reset the cell to factory conditions in the same way that we reset the phone to factory conditions, right? Like we can reinstall the software, we can reinstall the operating system and recover our ability to function well. And so this theory holds that over time there is kind of this epigenetic drift that happens where our DNA just becomes more noisy. There's different things that enter the DNA and make it function less effectively. And if we can clean all of that up, we can restore our ability to function youthfully. And this would have huge implications on not just disease, but aging itself. And of course, this was based on Nobel Prize winning research, which found that there are four different proteins that, when expressed, can basically reset cells to their factory conditions, help them remember their original function. And these are called the Yamanaka factors. And there's been really, really exciting results in animal models and in tissue culture. And what's being studied here is doing this in humans and doing it in specific conditions that otherwise do not have very much in the way of treatments. And so how should we think about this? I think super exciting. But we are quite a ways away from reversing aging in humans. Reversing aging by 75% animal tissues, as has been claimed, is actually still a long way from reversing aging in humans. And remember that these phase 1 trials are going to be safety studies, not efficacy studies. And this is basically a gene therapy. And so what we're testing here is a gene therapy in the eye, which is thought to be one of the most accessible tissues for gene therapy. And so even if this is successful, it's not a guarantee of success in, I think, the bigger prize, which is systemic aging, right? Like how do we change aging in the brain? How do we change aging in the heart, in the liver? Accessing those tissues is much, much harder. And so we have to just keep that in mind as we look at this new experiment, this new trial. I think the other thing that I would just point out, and I think this is just a criticism of the information theory of aging, which I think is super, super interesting, right? And I'm not saying that I have a position on whether or not it's correct or not, one way or another. I think it's just worth thinking about what the opposite case could be. And what I want to point out is that the information theory of aging holds that basically when we have this noise that builds up in our DNA, like that this is the driver of the aging process, right? Because our cells aren't able to execute these programs because the DNA is filled with all of this epigenetic noise, we can't execute the programs that we need. And so if we can just restore the DNA, reset it to its factory conditions, we can fix everything. How do we know that all of this noise is not the consequence rather than the cause, right? If you look at some of the pathways that converge on epigenetics, a lot of them, relate to things like inflammation, metabolic dysfunction, senescence. And so is all of this epigenetic noise a consequence rather than a cause, right? And I think that is an open question. That's what a lot of people who criticize or kind of are skeptical about the information theory of aging will say, is how do we know that this is not a cause rather than an effect, right? How do we know that it's a cause rather than an effect? So just keep that in mind as we think about this. But I think super interesting. A lot of people have different opinions on David Sinclair. I think he's a super interesting person and worth paying attention to for sure. So our last topic relates to NAD. Um, and Rhonda Patrick, who I'm sure a lot of you follow, put out a post, or talked about in one of her podcasts how she is using now nicotinamide riboside, which is an NAD precursor, as part of her health protocol. Now, I'm not saying that we should index on what influencers say or do. I think if anything, there is a problem of people over-indexing on influencers. But I do think that influencers have a major platform. They affect how people think about different health topics. And I think that when an influencer who has significant influence talks about something that's worth discussing, I think it's worth us addressing it here. And so NAD is a supplement, or NAD is a molecule that our cells, in kind of simple terms, use to help generate energy. And so if you think about energy being foundational to everything that a cell needs to do, you can understand why NAD deficits or depletion can lead to disease and aging. And this has been one of the frameworks or models that's been out there for the last 10 plus years, has been that, hey, is a lot of the aging process driven by NAD depletion? And there's debate about the validity of this. There is examples of disease states, inflammatory states being characterized by excess NAD. At the same time, there's also examples of certain diseases being caused, or thought to be caused, by insufficient NAD. So very, very much an open debate. And there's many out there who claim that taking NAD can help slow down the aging process. And there are others who would say, hey, this is not something we should just throw around willy-nilly. We should be more thoughtful. So what she said, which I think is worth talking about, relates to, I think, a more thoughtful and focused use of NAD, which I think is what we should move towards. Is how can we use this tool in circumstances where we know it's going to be beneficial? And so NAD can be, and this is what she talks about, can be really beneficial in helping to facilitate recovery from exercise, and can be something that helps to bolster our immune system when it is under attack from viruses and other pathogens. And I think there's actually, when we think about things mechanistically, there's quite a bit there that I think would makes sense. There's no clinical trials here, but if you think about what happens when we exercise, what we're basically doing is massively depleting our ATP, or rather our NAD pool, right? In order to exercise, we're having to generate large volumes of NAD, and in that recovery phase, we are often operating at an NAD deficit. And so at the same time, when we're recovering, there's a number of different programs we have to execute to make sure that we recover effectively. And so that's where NAD supplementation can be quite beneficial. And I think that using NAD thoughtfully, on days that you work out, could make a lot of sense. And so doses of NAD that people will use vary. In my experience, you generally, if you're using NAD for any purpose, you have to use at least 500, if not 1,000 milligrams to get a significant noticeable effect. That's just been my experience. There's others who might feel differently, but when you are using when you're using up your NAD pool, for example, when you exercise, you might be well served to restore that pool by supplementing with NAD. And I think that the larger point I want to make is, you know, what I like about this, and again, there's no clinical trials. We don't have any clinical trials to prove this, but we're at least being thoughtful about how we're using this tool. We're not just blanket using it and saying, hey, this is going to be something that helps us with aging and it'll make me younger. We're saying, hey, like we're going to use it for this specific reason in this specific circumstance. And that also gives us an endpoint to measure this against, right? So if you use this in a specific way, in this case to help facilitate exercise recovery, you'll be able to be your own judge of whether or not it's working for you. You have an endpoint to measure against. Um, and contrast this with if you're just using it for general like anti-aging purposes, like it can be hard to figure out like is this thing actually working? Like what's the actual goal? Um, and so this is something that I'm personally gonna try out. I actually do not supplement NAD on a regular or NAD precursors on a regular basis, but is going to be something that I'm going to try out, and I'll report back on kind of my experience with that. Um, but I think like my message to all of you is, to try to think from first principles and try to think thoughtfully about how to use a tool like NAD for specific purposes rather than having it be a blanket tool that you use, for quote unquote anti-aging. Okay, all right. Well, we are at 30 minutes, which was my goal for this. Please send me feedback or thoughts on this. I'm gonna try this out maybe a few more times, see how it goes. And yeah, I definitely welcome feedback. And